Today, we bring 3 prostate problems to take into account by Peter Ashia. The Peter Ashia Drive is a deep dive podcast focusing on maximizing longevity and everything that goes into that, from physical to cognitive to emotional health.
With it, it's an organ that sits in line with the urinary tract, and so the urinary tract in men has a dual purpose. The genital urinary tract is a dual purpose. One is used for reproduction, the other is used to kind of eliminate all the urine. And so because of that shared functionality, you can develop problems in one or the other of those two disease systems, and they result in symptomatic issues. And a lot of the problems that men, even at a young age, but particularly as they age, will experience are related to the prostate. So in some ways, it's kind of the nexus of the lower urinary tract. So yeah.
Prostatitis is inflammation of the prostate and can affect men of all ages. Although it is more common in younger men, it can be caused by bacterial, viral infections, or other agents. Typical symptoms include pelvic pain, difficulty urinating, and sometimes fever.
Experience are related to the prostate. So in some ways, it's kind of the nexus of the lower urinary tract. So yes, it's absolutely true that in younger men, you can develop infections in the urinary tract. They can be very problematic and difficult to solve and address if it's involving the prostate. Additionally, if you develop an infection, classic bacterial or potentially viral or other kinds of causes, you can get inflammation in the prostate, which can result in long-standing long-term pain. So that's one of the things I see when young men come in with prostatitis. Then as men evolve and age, as the prostate evolves and changes as we get older, different issues arise and they can result in an impact.
Prostate cancer is another critical problem that affects many men, especially as they age. It is one of the most common types of cancer in men. At first, prostate cancer may cause no symptoms, but as it progresses, it can cause urinary problems similar to those of BPH.
The men at age 50 and older will have, issues with lower urinary tract dysfunction, and those almost always directly relate to the prostate in some way or another. So some of the stats are pretty staggering. So at age 50, it's probably 50 to 60% of men have lower urinary tract dysfunction, but by age 60, it's 75 to 80% of men will have lower urinary tract symptoms.
So let's talk about what those are.
Typical lower urinary tract symptoms: weak stream, hesitation or slowness in getting your urinary stream started, urgency to go to the bathroom, increased frequency to go to the bathroom, and they're related to two things. One, functional obstruction of the urethra. That's the tube that we urinate through, the tube that comes out of the tip of the penis, and that tube, the first part of it passes right through the middle of the prostate. So as the prostate enlarges, it can compress that channel, and that can result in weak stream. It can result in dribbling and straining. Additionally, the muscle above the prostate is the bladder. The bladder is a bag, a storage device that is muscular, and so that muscle, as the diameter of the tube narrows with increasing size, for example, that muscle will have to work harder. Compliance will go down, and when the compliance of the bladder goes down, the capacity can go down, and the increased urgency to go to the bathroom will go up because it's less stretchy. So again, as we get older, parts of the prostate will grow. Oftentimes that growth of the prostate results in narrowing of the channel. That can concomitantly lead to thickening of the bladder wall, and then that results in a whole constellation of urinary symptoms, which can be managed, but many, many men have them, and it's certainly something that we talk a lot about with almost all of our patients.
Subscribe for informative videos for your health, like it,